Recording in progress.
Hello everyone. Welcome to Pre-Rehab series that we are recording with Cancer Bridges from Pittsburgh, Pennsylvania. This is a part of preparing the patients with diagnosis of cancer for upcoming cancer-related treatments, whether it is surgery, chemotherapy, radiation therapy, or a combination of these. This is the second part in the intervention for pre-rehab. I have mentioned in my previous lectures that I have tried to bring forth as many evidence-based practices as possible, but I want you to do your own research to make sure that these practices are applicable to you and will benefit you to go through the cancer-related surgeries and treatments more gracefully and make a stronger version of you. This is from the first part, steps for rehabilitation, and we are talking about intervention part in the pre-rehab. This is whole body mobility exercises. Exercises are not only important for bones and muscles, but they help all the systems in the body, whether it is your nervous system, cardiovascular system, pulmonary system, digestive system. All of these systems benefit when you move. Hence, motion is lotion for our entire body. Some of the benefits of mobility exercises are they maintain or improve range of motion of all the joints of the body. They help improve the activation of the muscles. Therefore, they help reduce the risk of injury by improving your balance, improving your capacity to transition between different positions, sit to stand, stand to squat, steps, walking, etc. They have been proven to improve your recovery rate post-surgically. Pain management is also a very good benefit of mobility exercises. Better surgical outcomes because you can move better, move faster, and obviously improve blood circulation. So I'm going to keep repeating this mantra throughout the video of motion is lotion. These are few examples of mobility exercises that I have pre-recorded for you. I'm hoping this will be helpful. The first part of this exercise, we are starting from bottom to the top. So these are simple ankle pump exercises, almost like you are pressing on the gas and releasing it. Very, very simple exercise, but again, very effective to decrease the swelling in your lower extremity when you're recovering and have less movement, to prevent the chances of blood clots or any embolism because of immobility. These exercises are very helpful, could be done within few hours of your surgery and could be done forever. They are always proven to be very effective and very helpful to not only improve the circulation in the lower extremity, but also to prevent certain post-surgical complications such as blood clots or embolism. So these are ankle pumps. I recommend doing them at least 30 to 50 good ankle pumps in one session. You could do 1 or 2 sessions a day. The second ones are spread your legs apart and just do slight rotations of your hips, internal and external rotations of your hips, almost feeling like windshield wipers. Again, really simple, really effective exercises, no equipment necessary, could be done within few hours of your surgery. I wanted to include them as your pre-rehab exercises so that your body already knows what to do. You have already built a muscle memory and you are familiar with these exercises to be done right away after your surgery. The third ones are just opening your legs and closing. If you have any kind of abdominal procedure like hysterectomy or any other colorectal related cancer surgeries, etc., and if you're not able to do a lot of movements around your hips, these are simpler exercises. They're modified version of your hip strengthening. These could be done without causing a lot of strain on your scar tissues or on your sutures around here. So I'm just making like a 4 with my arms, but they are with my legs, but they are fully supported on the floor, and I'm just sliding and gliding my ankles, almost like trying to touch the inside of the opposite knee and coming out. If you're able to bend your legs nice and slow without causing any strain on your sutures, I recommend doing slow hip rotations. My aim is not to touch the floor. My aim is not to cause any additional stretch to my leg muscles or my ligaments or my lower back. My aim is just to mobilize and move my muscles, the body fluids around, and just like calm down any kind of pain that you're having from immobility. If you're allowed and you are able to do it before your surgery, we could also include knee to chest. I'm just going to slide down a little bit so you could see my entire body. So as I mentioned, if you're able to do side to side leg rotations, these are very good exercises for relieving any pain or discomfort that you're experiencing in your legs or your lower back. You could also add some knee to chest, nice and slow. My aim is not to compress my stomach. Aim is not to really hurt any ligament or muscle, but just to increase the mobility in my lower extremity. Let's move on to the second part of mobility exercises, which are upper extremity mobility exercises. The following exercises is going to focus on the upper half of your body, including the neck and the chest. Again, no matter where you are undergoing the procedure, our body is extremely connected. The nerves and the spinal cord that begin here, they pass through entirely through your trunk into your tailbone. The nerves that are starting from the neck, they come all the way to the tips of your fingers. The nerves, the diaphragm that is sitting between your thorax and your abdominal cavity is focusing and improving the function of all the system above and below the diaphragm. Hence, we want to focus on whole body mobility exercises when we are preparing for any upcoming procedure. So whether you have lung cancer, breast cancer, any GI cancer, any pelvic floor related cancer, or any other cancer like lymphoma, etc., we want to focus on the whole body movement. So let's begin with some upper mobility exercises. These are simple exercises. I always focus on using no equipment or minimal equipment so we can practice these exercises anywhere at any time of the day. So these ones include neck movements in 3 different directions: straight in the front, straight back, straight in the front, straight back, straight to the side, almost trying to reach your ear to your shoulder, turning your neck to look at your right shoulder, coming to the center, turning your neck to look at your left shoulder. You could do all of these exercises for 5 to 10 repetitions depending on how good you're feeling, your time availability, and what part of your body you want to focus on. So these were the neck exercises. Then we come at simple shoulder rolls. So even if you do not have good or full mobility of your shoulder, just rolling your shoulders back down, almost like you're dropping your shoulder blades into your back pockets of the pants, and then rolling them forward. Breathing in, breathing out. Using our hands to open the door and close the door. Keeping your elbows at almost 90-degree position, opening the door and closing the door. Breathing in, breathing out. Clasping your hands in a prayer position, doing a good shoulder flexion, straight up and straight down. Opening your shoulders to the side and making good rainbows with your shoulder. Really good exercises if you are planning, if the doctor has recommended radiation treatment as a part of your breast cancer treatments. These will help you to position your arms really comfortably while you're having radiation in your affected side. So very, very simple rainbow opening and closing of the shoulder. Breathe in, breathe out, breathe in, breathe out. If you're not able to do complete motion, you could even use a wall to just slide your shoulder straight up, like you're just walking your arm straight up. And once you feel a light stretch, you can go just a little further and walk your arm straight back down. Straight up and straight back down. You could even face the wall and do a similar movement for the front of your chest and your shoulder. Get a nice light stretch and come back down. Let's go to the third part of mobility exercises, which are thoracic mobility for the central part of your body. These are yoga-derived exercises. You could do it seated on the chair. You could be cross-leg sitting if you're able to get on the floor. It doesn't matter. Any position where you're able to sit comfortably is good for these exercises. Very, very good exercise for any kind of surgical procedure happening either even in your breast, in your pelvis, anywhere in your abdomen, or just a good exercise to make you move better, feel good, breathe better, have better bowel movements. So this is, you're making circles, almost like you're stirring a pot. So I'm using every single joint. I'm moving from my shoulder, from my ribs, and I'm just taking a nice big pot stirring circle and coming in a reverse direction. Everything is super comfortable. I'm not straining any joints. I'm not putting force on any part of my body. I'm making it a really, really, really light exercise. You could use your neck. You could bend with your neck. Use your neck if you do not have any episodes of dizziness or vertigo or any other vestibular symptoms. You could use your neck. If you feel that you have any of those, you can gaze in front at one single point and just move from your trunk, almost like you're stirring a pot. The second one is side bending. So I'm just making a rainbow, but this time I'm going to use my side of the thorax. Breathing in, opening the chest, opening the abdomen, and closing. And the last one I'm going to show you sitting on the side. It's a modified version of cat-cow, where you're using your thorax and your pelvis to go into like a cat position, coming out. Opening the sternum, opening your diaphragm, shining your sternum up towards the ceiling, bending down, looking at your tailbone. Let's come on to the last part of exercises, which are modified lower extremity exercises. For patients with limited mobility, they can do them in the chair, by the bedside, while watching a TV show, or even waiting in a doctor's waiting room for long appointments. Let's go ahead and learn the modified lower extremity exercises. These are chair-based exercises. They could be done by your bedside. These could be done whenever you're allowed post-surgically, but I wanted to include them as your pre-rehab exercises so that you can start practicing them even before the surgical procedure or any other form of treatment, so that you can move better and have less discomfort in your body during and after the procedure. So let's go ahead and start doing them from the lower extremity, and then we'll focus on the upper extremity. So like the lower extremity, first one are the ankle pumps, taking your ankle maybe one at a time or both the ankles at the same time, up and down, and making some good ankle circles. Ten to 15 circles, up to 30 circles could be done at one time. Bringing your knee up and down. Bringing your hip. Do not judge yourself how high you're going, how well you are moving. Make your intentions clear that I want to move. I want to move so I can keep moving better and recover faster. It doesn't matter if your ankle is just going couple of inches up and down. It is still a movement, and motion is lotion. This is still going to benefit you. Do not judge yourself. Do not strain any ligaments or any tissues in order to move faster or higher. Just focus on slow, good movements without putting pressure or causing discomfort in any part of the body. Focus on your breathing, focus on calm, relaxed posture. We are not trying to get ready for any kind of competitive sports. We are just helping ourselves so that we can keep moving the fluids, keep our nerves loosey-goosey, keep our muscles nice and soft before and after the treatments. Lifting your knee up and down. You could even go sideways, like making modified butterfly position with your legs. Very, very helpful exercises so that you have less strain on your abdomen, less strain on your pelvic tissues, and you're able to start moving better and walking faster once you're ready for that. I'm doing the reverse motion, reverse butterfly. It could be as simple as this, like windshield wipers. Still very helpful. In the summary, I would like to reinstate this statement. Movement is a medicine for creating change in a person's physical, emotional, and mental states. I'm hoping that you find these series of pre-rehab videos helpful in order to help you prepare better for your upcoming cancer treatments and surgery. Thank you for listening. Thank you so much.